the M Factor film, which will be shown this weekend at the K-Pop Hotel. Joining us this morning virtually is Dr. Simone Van Horn to tell us just a little bit more about this story and some of the offerings that you can receive on Saturday. Good morning, Dr. Van Horn, and welcome.
Good morning. Thank you for having me.
It's a pleasure to have you with us on the show this morning. Thank you so much for joining us. Let's go into the story of the M Factor film. I know you said you wanted to tell your story as a baton to empower women. Let's unpack that and tell us from the beginning to now how that started and how it's going.
Okay. So let's talk about the M Factor as a documentary. It really is a documentary, and what it is a revolution, really, of sorts, of a group of women who've been going through menopause and a group of doctors who have been trying to sound the alarm about the misconceptions that there are around hormone replacement therapy and the vital need for us to change our approach to how we approach women's health as it relates to hormonal therapy. So 20 years ago, we had a study called the Women's Health Initiative Study. And the Women's Health Initiative Study is really what caused a lot of the fear, a lot of the mistrust of hormones, and really it created in us as physicians a culture of fear in of itself. So hormones are just sort of taken off the table unless you're like literally almost dying, almost suicidal, major symptoms of menopause. Have to take your clothes off 3 times a day, right? These are the things that women are going through. But the Women's Health Initiative study, the principal investigator tried to walk back a lot of the findings of that study, because that study was really done using pharmaceutically derived hormones, right? Pharmaceutically derived hormones are not a proper lock and fit. If you think of your receptor as the door, and we think of the key as the hormone. If you have a proper hormone, it turns that key nice and smooth. If you have a pharmaceutically derived drug, it has all these molecules on it, right? And when you try to turn the lock, it jiggles. And those are your adverse effects. So cancer were side effects, strokes were side effects, right? However, we didn't really look at what identical hormones, like if we replaced our hormones and just had them go on for a longer period of time, what did that do, right? So the study did not look at that. And in fact, the study did show that 50% of women had slowing of dementia, which means that memory problems, all the intervals in terms of memory problems up to that, right, were decreased by 50%. And now we're trying to walk back really and correct this, because most women are afraid of dying of breast cancer because of like all of the media hype. But really, more women are dying of cardiac disease, right, than breast cancer. Most of our nursing homes, I'm here in the United States, they exist because we have our elderly patients who have dementia, they can't be by themselves. They have behavior problems, they can't be by themselves. They have hip fractures, right? All of these things, if we extend hormone replacement therapy, we now know that estrogen and the backative of testosterone will help the bone integrity. We have less fractures. Dementia is decreased by 50% with estrogen alone, and that increases by giving our women back some of their own natural testosterone as well. And these are some of the things that the M Factor really addresses, right? Now, the reason why this is a passionate thing for me, I'm here in Florida. Why am I coming to Florida, right? It's a passion for me because of my own perimenopausal experience and my menopausal experience. And the fact that my training as a physician, and this is also brought out in the documentary, that our training as physicians do not equip us to even recognize when the things are happening in our own bodies. So for me, I was quietly minding my own business, working, thought that my exhaustion, my extreme exhaustion was just because I was working so hard, which is what a lot of women out there think. They're just exhausted because they were working so hard. Mm-hmm. And one morning, I went back home to get my son who had overslept. And there is a daycare that is on the facility of the hospital. And the hospital is only 5 minutes away from where I live. So it's not a big deal. On my way home, I had tons of phone calls. So I was really super distracted. Got my son, got him in the car, went back and thought I took him to daycare. I didn't take him to daycare. I had left him in the car. They were paging me in the hospital to try to get the door open. A passerby just walked by the car. Um, the fire truck had to be called. They had to bash open my window. Police were called. I nearly lost my career. My colleagues were looking at me side eye like I had like 10 heads, like wondering what the hell is wrong with you. I had to go through psychological testing. I had to go through psychiatric testing. I had to go through MRI. I had to go through CT scan because it was like, what is going on? Concurrently, there were all these other things in the media as well of other people who had been doing the same thing. And the media, as well as social media from the public, it was exceedingly judgmental. Lock them up, put them in jail, right? They don't deserve to be out here, right? I am here in the fetal position, like bawling my eyes out, right, for months because I'm like, how could I have done this? How, right? Anyway, walk that forward. I was in perimenopause, didn't know it, didn't have a clue, didn't check my levels, didn't know anything. We're not taught to check levels.
Yeah.
So I then go into menopause and then it becomes obvious, right? I didn't attach the two things together, which is why this M Factor documentary is so important. It shows the changes that happens in a woman's brain as they start to lose their hormones. You're going to see the scans, so you're going to see what a hormonal, well-hormoned, well-primed brain looks like, right, when it has its hormones. And you're going to see, as you lose your hormones, the changes that are happening in scans as you lose the hormones, right? And it's going to link to why we're feeling the brain fog, why are we forgetful, how could I have left my child in the car? I can talk about it like this now because as a physician, I now understand the physiology. And that's the baton that we want to hand to this next generation. We want them to understand that us in our generation X, we didn't get that from our mothers even, right? We didn't know, I didn't know that it was so horrible, right?
Right.
That it was going to like ravage my body and ravage my brain the way it is. And this documentary is going to open that discussion. I'm going to be able to share this experience with other women. We have Gillian Smith Trumpet, who is from Men OTT. She's also going to be there to also invite people for a safe space for people to have company, right? Womanhood, sisterhood, right? This is the essence of being a woman, right?
Dr. Van
We're
Horn.
not all going to have babies. We're not all going to have periods. Some of us, our periods are going to be haphazard. Some of us are not even straight. Some of us are gay, right? But the one thing that is going to join us together as women is the fact that we're going to go through menopause, right?
Yes.
And the M Factor documentary is key to blowing that wide open, right? Allowing women to understand that hormonal change that's happening to them in their mid-30s, in their 40s, in their 50s, in their 60s, even into their 70s and 80s. And I'm going to be offering free books. We're going to have free consultations for all attendees. It does cost $350, but that probably is the cost of having a consultation anyway. And what we also get is sisterhood. We get to hear that we're not alone. We get to not feel as if we are aliens from outer space. And God knows, I know what it's like to feel like a total alien, right? And this is what we're going to offer.
A lot is, of course, just came out of that conversation. So thank you for sharing. One can only imagine what you would have gone through, and to see you being able to
Yes,
turn that around and definitely help the younger generations coming out of this with something that is so natural
yes,
to us is definitely a great cause. So thank you for that. And Dr. Van Horn, thank you so much for joining us this morning. Looking forward to seeing you
thank you.
continue to really push for that education and transform the lives of women throughout the
Yes,
world. Have an excellent day.
you too. Thank you so much for having me.